Hello, everyone. Welcome. My name is Adrienne Furness, and I'm the Executive Director of the Benton Institute for Broadband and Society. If you don't know us, we work to bring open, affordable, high-performance broadband to all people in the United States to ensure a thriving democracy. Today's event is in partnership with Common Sense Media and their state broadband policy advisor, Drew Garner, who will be our moderator today. Let me introduce our fantastic panel of speakers who have generously agreed to share their time and experience with us today. In order of speaking, we have John Horrigan, who is a senior fellow at the Benton Institute. Dr. Andra Daunhauer, Executive Director of Equal Access to Broadband in Vermont, and Elizabeth Ramirez, Digital Navigator at ConnectWaukegan, which is just north of us in Illinois. Thank you all for joining today. And Drew, I'm going to hand it over to you to begin our session.
Okay. Thank you, Adrienne, and welcome to everyone. I've seen a lot of familiar faces in the response list, and it's nice to be talking to you. A lot of you helped me, worked with me to understand the ACP, so credit where it's due. But thank you to Benton for hosting this panel. I'm Drew Garner with Common Sense Media, and we're a nonprofit dedicated to helping kids and families thrive in the digital world. In addition to our many other avenues of work, one of our recent projects was an ACP campaign in Phoenix, Arizona, where we ran a 3-month advertising campaign in partnership with Arizona State University and the Digital Equity Institute to turn the university's internal tech support call center into a Navigator hotline service. So on all of our advertisements, we were able to have a phone number that connected people to live 24/7 in-language support Navigator specialists. So that a lot of my lessons learned have come from that campaign. But also this panel comes at a very good time. ACP enrollment is continuing to rise strongly. The FCC is about to begin funding local enrollment initiatives through its recent grant program. States and ISPs are just now beginning to plan their BEAD networks and want to know about what the likely uptake of subscribers in various communities are. As you may have seen from Doug Dawson's blog yesterday, at the end of the ACP, people are seriously starting to think about the ACP's future. And I'll note that it's fun to have an ACP panel the day after Doug published that blog. It's good and it's important, and I think we will address it today. But given all these topics, I think we're very lucky to have these panelists, John, Andra, and Elizabeth, because each of them have extremely relevant experience with the ACP and are going to be able to share their insights at this critical time. So the main topics I hope to address today are how to make the ACP successful now that it's here, let's make it good, and then also why and how to make the ACP sustainable in the future. So first, we're going to talk about the first category of how to make it successful now, and then in the Q&As, we can dive more into why it must be sustainable. So I'll start with slide 1, just to have a brief update on the state of the ACP and a little background, just for anyone new to this program. Welcome. It's important, and we're glad to have you. So I'll just level set. And just to preface, this is very important. We're going to be talking a lot about different ways to improve the ACP. And they're all good and legitimate, but I don't want anyone to be confused that the ACP is not successful. The ACP currently is very successful. In little over a year and a half, it has grown to help more than 15 million households, that's almost 13% of the US, afford what is an essential service. So this program is helping 15 million people afford something essential. And it's done this in over a year and a half. I think that's pretty good. It also demonstrates the huge demand for broadband. And that affordability is an issue that people need help with. So the ACP is succeeding. For background, And this slide simplifies things, so forgive me. But the ACP is the $30 monthly benefit for internet service. It also has a device component and additional funds for tribal lands. It started on May 12th, 2021 as the emergency broadband benefit, and it has since evolved. As of earlier this week, we had 15,701,207 people enrolled, which is in large part thanks to a lot of people on this call. And then briefly, the 3 steps you have to take to get the ACP are 1, to qualify, then you apply, and then 3, you have to buy internet service. So it's not just a one and done thing. And each part of these, each step has some specific challenges and insights, and I'll go on to those now. On to my next slide. So to briefly talk about qualification, on the left are the 2 ways you can qualify: through income, by being below a certain 200% of the federal poverty line, and that varies by the household size, or more commonly, if you participate in a government assistance program listed down there. Main takeaway from this slide is the box graph on the right, which shows, I don't know if you can read it, but SNAP and Medicaid in blue and red, those are by far the dominant ways that people are qualifying for the ACP. And in a lot of cases, they're the simplest because of some database connections between state and federal agencies that allow to automate some of the verification process and recertification. But also lower, there's income, Social Security income, supplemental security income, and then free and reduced lunch. That's qualifications. Then on to the second or the third slide. This is some data. This data comes from USAC. They make this publicly available, and we can talk about specifics about the data later. But this shows 2 things. The graph on the left is the net new enrollment every month since January 2022. And you'll also see it's at a different scale than the graph on the right, just to avoid any confusion. But so this line represents new enrollment each month, and it's a sum of new enrollment and de-enrollment. So this is the net enrollment difference each month. And you can see that it spikes quite a bit, but it stays pretty strong, about 500,000 net new enrollment each month. And then the graph on the right, this shows all these lines combine to form the line on the left. It's a composite of these 4 enrollment pathways. Each line represents a different way you can enroll in the ACP. The red line is Lifeline. That's one way. And then there's Alternative Verifier in green. That's an ISP, can have its own process for enrolling people. Then there's the National Verifier in blue, which is up at the very top. That is where you go to the USAC website and enroll yourself. Everyone's pretty familiar with that. And then the red line, which you'll note, red line, Lifeline, you'll see dips negative. That's a 0 in the middle of the graph. And we can talk about that later during the Q&A. But it's important to understand that there's a mix of positive and negative numbers that compose the net enrollment. And that can cause local confusion when you get hit with a big negative in your county when you're in the middle of an awareness or enrollment campaign. But then fourth, there is the purple line, which is almost flat at 0. That is the fourth and very unused school-based enrollment pathway, which I don't think we will discuss too much. But on to my next slide, the final step of the ACP is when you actually buy internet service. So you are confirmed you're eligible, you've enrolled in the program, and then you take your benefit like a voucher and go to an internet service provider and use it to buy internet service or apply it to your existing service. However, we don't have as good data on this component because it's handled by the ISPs. And I've bulleted out a few questions that I would hope to raise during an upcoming proceeding. But just what we can say is that there's device uptake, and this is the sum of one-time device benefit uses, about 3 million, which was a little bit higher than I actually thought. And then also on the right, there you can see the mobile versus fixed usage. So this is one type of insight we can have into the type of service people are buying with the ACP. The first pie chart was in the emergency broadband benefit. That was December 31st, 2021. That was the ratio of mobile in red to fixed in blue. You can see much more mobile. But as the ACP has progressed, and John Horrigan can talk more about this, but we've shifted more towards an equilibrium between mobile and fixed. And we'll see what that pattern contains in the future. But then finally, my last slide before turning it over to the panel, I want to tee them up by saying the ACP is essential. It's very important. As long as poverty exists, we need some sort of cost support. And it has been successful. A lot of people have been enrolled. But enrollment can be challenging, especially for the target audience of the ACP, which by definition may have little technical skills or may not have the internet, which can make the online application next to impossible. Or they may not have a computer or camera with which they can upload or take pictures of their devices, of their documentation, or they might not have an email address or a password that they have access to. All these little challenges build up to make it hard for the truly disconnected to access this benefit. And all the pictures on the right, those are just screenshots of the verification process. But that can be very intimidating if you're not comfortable with these forms. So our panel today, starting with John, is going to talk about what they've learned to help people enroll. What makes the ACP successful? And I'm going to turn to John from the Benton Institute to discuss his statistical analysis of why some areas perform better than others with the ACP. John?
Thank you, Drew. And thanks everyone for your time and attention today. What I want to do is dig into ACP enrollment data in some depth, and I'm going to show several slides to do that. So if we can get my first slide up, and then the next one that just gets us going to content on ACP uptake. I want to say at the outset that there are three ways, or at least three ways, I'm going to have us think about ACP uptake, going from aggregate to granular. First, you can just look at overall enrollment figures. Drew has touched on that. The ACP via USAC provides information on enrollment for the nation, for states, for counties, and at the 5-digit zip code level. So it's not hard to go into the USAC website and get data for those particular metrics in the aggregate. Another way to look at it is in terms of the growth in enrollment and how that has changed over time. I'll have a slide on aggregate growth and enrollment over time for ACP, but you could do that at the state level, the county level, or the 5-digit zip code level to get a sense of how things are going in the particular geography that you're interested in. The third way, which I'll spend a little more time on, is on performance. And by that, I mean, what is the gap between actual enrollment levels and predicted levels of enrollment? And to get at that, you need to do a little bit of statistical modeling and analysis in order to come up with a prediction for enrollment for at the 5-digit zip code level. So that just entails running a regression to understand the predicted level of enrollment as a function of not just the number of eligible households in a particular area, but other socioeconomic factors that help predict ACP enrollment. And the basic motivation for doing it this way is to understand that poverty is not just an individual phenomenon, it's a social phenomenon. It's rooted in geography in many places. So you want to look at the poverty part, which is just the percent of population who's eligible for ACP, but you want to look at other factors relevant to the community in which people live, such as density, such as the presence of public libraries, which we'll see has a positive association with enrollment levels, and other factors such as teens out of work, percent of occupied homes, and percentage homes who are rent burdened. So that's what we're going to get to today. Let's first, in the next slide, take a look at trends in ACP and EBB enrollment over time. Drew covered part of this, but we've gone from 3 million enrolled in EBB at the outset of the program, and then up to, on my graph, which goes into December, 15.4 million households enrolled in ACP. And that comes to about 30% of eligible households enrolled in ACP in a matter of 18 months or so. Now, that's pretty good for a government benefit program. Some government benefit programs like Medicaid have very high participation rates among eligible households, something like 80%. But there's a 2014 Bureau of Labor Statistics analysis that shows, for instance, that 51% of SNAP eligible households actually enroll in SNAP. For housing assistance, something like 22% of eligible households avail themselves of housing assistance. So to get to 30% in a short amount of time, I think represents a pretty good rate of uptake for ACP. So that's encouraging. Going to the next slide, this is just a very mini case study of changes in ACP enrollment in the city of Philadelphia over time. And Philadelphia started out with 20,000 enrolled households in May of 2021 and up to 134,000 by the latest date that they rendered data at the 5-digit zip code for ACP. So that's a very good growth rate. On the next slide, I might have some comparative numbers. Oh, I don't. Let's back up to the Philadelphia slide. I can tell you that Philadelphia's growth rate is pretty good compared to several other cities. I think since the beginning of this year when ACP came online, or I should say the beginning of 2022 when ACP came online, Philadelphia has had about a 29% growth in ACP enrollment. And that's a lot better than Baltimore, for instance, which is where I live, which has had an 11% growth rate over the same time interval. Let's now go to the next slide and start to talk about performance, again, using Philadelphia as our case study. Early EBB data showed that Philadelphia was doing pretty well with ACP enrollment. It was enrolling about 106 people for every 100 that the model predicted. So it was doing 6% better than it's expected. Through October 2022 data, that's performance has sort of waned modestly. ACP now is unfolding in terms of enrollment at roughly predicted levels in Philadelphia. There's 132,000 households have enrolled, while the model predicts 134,000. So what are the drivers of performance above and beyond just levels of eligibility? Obviously, if you have a large population in a zip code that are eligible, you're going to have a better ACP uptake than a place like Bethesda, Maryland, which is very well off and has already a high rate of internet connectivity. So what drives performance? The presence of public libraries, the percentage of Blacks in a zip code. Tribal areas have a much higher rate of performance. Areas with a relatively high share of older adults are less likely to have good ACP performance. Areas with large numbers of foreign-born residents are less likely to be experiencing solid ACP uptake. And areas with lots of households who are rent burdened, perhaps not surprisingly, but a little bit discouragingly, have a negative correlation with ACP performance. And finally, population density is important. ACP enrollment is unfolding better in urban areas than in rural areas. So as you dig into the data, it's interesting to understand the where and the why of ACP enrollment. So to the next slide. Let's talk a little bit about the question of whether we are adding subscribers or granting cost relief to existing subscribers, or both with ACP and EBB enrollment. As Drew said, in the EBB days, 2/3 of enrolled households were taking advantage of wireless plans, which suggests that they perhaps were mostly using the benefit to get better wireless service and better data plans for much lower cost than they could before with just a lifeline benefit. The reverse has been true since ACP has begun. Drew's slide showed that 55% are now doing wireless versus 45% wireline. For ACP, that actually represents a reversal in pattern. It means that 2/3 of ACP enrollees are wireline, which could mean that some of this represents incremental addition to the pool of broadband subscribers. But we actually don't know for sure, but we do know that sizable numbers of households are getting cost relief. And that's important because we know that 46% of all lower income households say that fitting broadband into their budget is very difficult, which is to say many of that 46% who say that affording broadband is difficult are subscription vulnerable, which means that if something goes amiss in their economic lives, they may have to forego service in order to respond to an economic challenge that they may face. So ACP helps alleviate this phenomenon of subscription vulnerability because it helps keep people on the network when they encounter some economic obstacle. A survey I was involved with the city of Philadelphia in 2021 showed that something like 20% of Philadelphia households lost service during the economic upheaval of the pandemic. So for many low-income households, going on the network and off the network is not uncommon, and ACP is very important to helping them not have to give up service when things go awry in their economic lives. So let me go to the final slide to conclude about how some of this analysis of ACP performance is useful to decision makers. It does shed light on drivers of ACP performance in particular areas. So for instance, if you see in your city that there's a particular area where ACP performance is very good, that might invite inquiry into what might be behind that. Are nonprofits doing a particularly good job reaching into the community about ACP? Are public libraries doing a good job in their community in encouraging people to sign up for ACP? Then if you do find some clues as to why things are going well, you can replicate that in areas where performance may not be going as well. And this indeed becomes a tool for prioritizing community engagement. As many people on this webinar may know, the federal government, as part of the BEAD process of granting funds to states and granting digital equity funds to states, does require community outreach. And the ACP performance tool, by shedding light on where performance is going well, can help decision makers and planners reach out to those communities in the community engagement process to bring them in the fold on how to best use funds that will be coming from the federal government for broadband outreach and for digital inclusion. So with that, I will conclude and turn it back over to Drew.
Thank you, John. I always appreciate your findings about libraries, and I want to hear more from you about that in the Q&A. But for now, I will turn over to Dr. Andra Daunhauer from Equal Access Broadband EAB, where she's using the ACP to help local ISPs bring quality, affordable broadband to Vermont's communities.
Thank you. So I'm going to talk to you today about what Equal Access to Broadband is doing in Vermont, how we're doing it, why we're doing it, and what we have found successful in getting folks connected with the ACP program and getting internet service providers able to make these claims in the system. So as Drew and Adrienne said, my name is Andra Daunhauer. I'm the Executive Director of Equal Access to Broadband. We're a Vermont-focused nonprofit, and what we do is help get people who want to know if they're eligible verified for the ACP program and make sure that they're getting service. You can go on to my next slide, please. So I'm going to go quickly over this because Drew has already talked quite a bit about how the ACP works. The majority of the eligibility criteria for households to qualify for the ACP are defined by economic need. And just to put that into practical perspective, again, the federal poverty level means that a family of four is living on about $52,000 a year. And a single person's living on about $25,000 a year. So pretty slim margins there for folks. So $30 a month off of whatever their cost of internet is a huge deal. You can go on to my next one. Our organization was founded with the purpose of using available resources like the ACP to help these households get connected with our local ISPs. Because their mission is to provide their constituent communities with high quality internet. Now, I want to be clear that we will help all Vermonters regardless of their ISP, so we consider ourselves ISP agnostic. However, because there's an alignment between the local ISP's missions and our mission, we've been able to cultivate relationships with them. So just want to be clear about that. Anybody can call us, anyone can be referred to us. We will help them get connected, and we will not just get them verified for the ACP, but give them the information they need and any support they need to get that subsidy applied to their bill. We can go on to the next one. So really this is about providing mutual benefit of sustainable infrastructure support for a largely rural state. The local ISPs are committed to serving areas that have been under and unserved for years. And resources like the ACP make the available internet service affordable. And our role is to help that affordable service accessible to everyone, both on the side of Vermont households and the side of ISPs. You can go on to the next one. So these are what we consider some of the bricks in our bridge that we've built here on getting subsidized service to ISPs and discounted service to households. We have a process for customer engagement. I'll give you a little bit of an example of that later. We're building a database to track important measures of success and communicate with ISPs through that database as well. So we share that so it's available to both parties. We have a social services-based training for navigators, for our broadband navigators, who actually are the ones who are working directly with Vermont households and the ISPs to get everything set up and connected. So it gives the households a responsive and well-informed experience of getting their subsidies in place. We are helping with the revenue for the community-focused ISPs through the ACP subsidies. again, to build into their sustainability. And we've got both tailored and diverse community outreach, which I'll go into a little bit more in detail later. And we, offer, the other thing that we do is offer support for the ISPs in navigating the USAC process. So, one of the things that we pay attention to in terms of our success is not just, successfully verifying X number of households, but how many claims were successfully made by ISPs, meaning that the ISP was able to claim them in the USAC system, in the National Verifier, and therefore the households are getting subsidized service. We can go on to the next one. Oh, is there one before that? No, okay. So this is a little bit more about our process of customer engagement that I described before. We've broken it down into 5 steps, 4 of which directly involve households. And this is more of a detailed look at the documentation step when that does come up for people applying for the ACP program. Just thinking about, those 3 kind of parts that Drew talked about of how you actually get your subsidized service. This is broken down even a little bit more than that. So we start with initial contact, whether it's through a referral source or from the household directly because they heard about us in various ways. We collect the information needed to make their application. We have multiple ways of doing that over the phone, through text message. Sometimes that's either more comfortable or easier for folks to do through text message. We can also do it through email, and we're looking very soon to start being able to have a live chat feature on our website as well. So sometimes in the application process for the ACP, the system is not able to verify somebody's eligibility, and so documentation is required. And Drew spoke earlier of that can be a barrier for some people of first of all locating the document that's going to be accepted. So we will help folks, we can give them a really broken down description of what the document has to have on it. They can take a picture of something and say, will this work? We can look at it and say, well, it might work, but you need to take a better picture of it because I can barely read it, or whatever the issue is. And that way we're providing the National Verifier system with the best possible result in terms of getting the documentation reviewed and accepted to get their application through. Sometimes when we upload a document that has all of the information that is requested by the National Verifier, sometimes it still gets rejected by the reviewers. And so we are able to call on behalf of the household and say, hey, what's up? How come, why are you saying it doesn't have the seal of the, provider of the program when I can see it right there? And they'll resend it up for review and it'll get accepted. So we're able to do that advocacy as well. So after the documentation gets accepted, the household gets fully registered in our system. So we're able to help them if anything else comes up later, if they need other resources, digital literacy or some other, related help with something. We're available for that. And then we can support them if other issues come up with their application. And then, finally, the 5th step, we make sure that service is initiated, that they're getting high quality, affordable internet at their home. So that's our, sort of household engagement process. You can go on to the next one. Thank you. So major things we've learned about helping serve this population. One is that effective application support is crucial. It takes us an average of 2 to 2.5 hours per household to get them from initial contact to they have a verified, they're verified for being eligible for the program, and they're ready to go find an ISP and get signed up. The local ISPs that we work most closely with, they have a community-wide mission, but they have to focus on take rate. They don't have the time or the training to effectively support this population. And you think too about contrasting call centers of larger commercial carriers that can only allocate a window of 15 minutes or less for intake of each customer. And many of those commercial carriers have, really shared the ACP resource as a very DIY experience for people. Just here's the website, get yourself signed up, and when you're ready, then you come and give us the number. So we're there to kind of, again, it's like the bridge metaphor, but we're there to sort of support them through that process. And just to, kind of underscore this, the 2 or so hours to verify a household doesn't include the time it can actually take to get the service to the household. I just read some data this morning that only half of the Vermont households that are enrolled in the ACP as of October of 2022 are being claimed by an ISP. So that means that half of them got verified to receive a discounted service, but they aren't getting it, or they weren't as of October. So that says to me that there's some support is needed there, both for ISPs and for households. And there could be other stuff going on in there, but that's an important thing to pay attention to. So, the claims process for providers isn't necessarily straightforward either. And we have developed a feedback mechanism or system to ensure that ISPs are getting their subsidies and therefore households are getting their affordable service. So next slide. Thank you. The other, big takeaway is that this population needs a motivation for broadband service, not across the board, not 100%, but this is a feature of living with very few means. There has to be a really good reason to pay for another bill. We can help households find reasons to make them want to invest their time, effort, and what little cash they have available in broadband service. This is why our outreach is based on relationships with other service providers. Information about the ACP and our services is coming from an already trusted source with an embedded rationale. For example, with schools, with veterans groups, healthcare and social service providers, a story that we reflect on a lot from the early days of our organization is one of our board members is an educator. And during the pandemic, he had a student who had to climb on the roof of his shed with his cell phone because that was the only way he could do his schoolwork. Because that was how he could get a signal on his cell phone, because it was the only way that he could access the internet. That's not equitable access. So, and I have some stats up here about, some research that's been done on beliefs among low-income households on broadband internet necessity. You can go to the next slide. Thanks. So, this is, our whole mission is about community inclusion. And the CUDs that are referred to on the slide, that stands for Communication Union Districts. That's what Vermont's system of local ISPs is called. Our goals are multifaceted, but they're all rooted in the connections among all of the parties involved in the equitable provision of high quality internet. We measure our success using results. So number of households, getting enrolled, number of households getting served, how many ISPs, how many community members are ISPs able to serve, all of that. But we also measure our process. So we measure the effectiveness of our actual process of engagement and the relationships that we're forming, for example, with collaborators, with the community, all of that. And, putting that together, that gets us, moving towards our goal of inclusion. Because it's not getting the internet to the household that helps them. It's what becomes accessible to those households once that tool is within their grasp, whether that's education, connections with loved ones, community support, telehealth information. And those are the good things the internet can provide people. So we can go on to the next slide. So that's it. Feel free to contact me, check out our website, but that's what we're doing for Vermonters.
Thank you, Andra. I'm glad that Vermont has an organization like this that's connecting like the local ISPs and using the ACP as a way to bring connectivity to new homes. I think that is awesome. And I think it highlights the importance of the ACP to how ISPs grow and build their networks and where they serve. So I appreciate that perspective. All right, and for our final panelist, Elizabeth Ramirez from ConnectWaukegan, here, who has a lot of hands-on experience as a navigator, always has insightful comments on that. And Elizabeth, I will let you tell us about ConnectWaukegan and how you are connecting communities in Illinois.
Thank you, Drew, and thank you to Benton for inviting me to speak on this webinar. My name is Elizabeth, and I am a digital navigator at ConnectWaukegan. We are located in Waukegan, Illinois, just north of Chicago, and today I want to talk about what we've learned about the ACP enrollment process and also share with you some enrollment strategies that have helped us along the way. I am not, okay, there, I see the slides now. Thank you, Kip. We can start with the next slide. Thank you. So I want to set up our community dynamics for you and talk to you a little bit about how our community looks like and why we do the work that we do. So we do our work here in the county, though we are based in Waukegan. We extend our assistance to different communities in our county, and these communities are urban. They have a high immigrant population, a high Spanish-speaking population. Most adults have low digital literacy skills, and you can see that some of our communities' income is below the federal poverty guidelines. So keeping this in mind, our population cannot access this benefit on their own for all of these reasons. So what works best for our community is a just-in-time field agent model in which we are deploying digital navigators at the time that people are actually doing this work. Our clients could not be walked through the ACP enrollment process if we were a call center. It simply just doesn't work. Many don't have multiple devices to complete the application or the digital literacy skills to take pictures of their documents and upload them and, wait for them to be reviewed. And overall, just simply understanding that this process entails a lot can be scary for a lot of our community members. So our model ensures that our clients are getting the in-person, one-on-one assistance that they need. And by using this model, we have reached over 2,500 community members, assisted over 350 households in initiating the ACP enrollment process, and have ensured that 245 of those households are completely ACP enrolled and already saving money with their chosen ISP. Thank you. So I want to start talking a little bit about one of the first things that we realized we needed to do right at the beginning, organization, because we recognize that ACP does not stop once an application has been approved by the national verifier. And this is something that Dr. Andra touched on as well. Applying the credit with the ISP is equally important and is crucial to a successful enrollment. So we have identified 7 critical phases to making home internet more affordable using the ACP. And this process of phases starts at the beginning with that initial contact, building rapport with the community member, telling them about the ACP. And you go down the list of steps to making an appointment with them to sit down and complete the application, to step 5, getting their application finally approved by the national verifier. And then steps 6 and 7 come in, and that is the work that we do after the application has been approved by the national verifier. So in step 6, we sit down with the applicant and we help them contact their internet service provider, and we help them advocate for themselves and fully understand what is left of this process. We help them apply their credit to their account, and then we also follow up multiple times to make sure that they are in fact receiving the credit after a month or after their next billing cycle or whatever that time frame is. But we get our clients through the entire process. And the fact that it takes more than 90 minutes and multiple visits and conversations to complete all of these 7 steps tells us that this process is complex, like Drew has talked about in his part of the presentation. And a lot of the time, community members cannot do it on their own. So ensuring that you are also providing assistance with steps 6 through 7 is extremely important. Another great enrollment strategy that we've found that helps a lot is creating partnerships with community leaders and organizations. And some of these leaders could be the public housing authorities that exist in your community. Partnering with the local housing authorities can lead to a long-lasting partnership. And every resident within those properties will qualify, at least through federal public housing assistance. Many will also participate in programs like Medicaid or SNAP, which obviously facilitates the ACP enrollment process. It's also important to go to people. So visiting local housing authorities makes it easier to reach senior residents or disabled residents and a lot of the populations that can't always come to you. If you're working with property managers, a lot of the times they will also be able to provide documentation for residents, such as a copy of their lease that you can upload to the application and other important materials. And creating partnerships with local ISPs and housing authorities can actually go hand in hand. Some ISPs like Comcast may already be the internet provider for some public housing properties that typically have representatives that oversee the accounts in those properties. So partnering up with them can help you collaborate at events and can help you with that next phase after you get the application approved. If the ISP is there with you at the housing property, they can help the client actually apply their ACP credit to their account. In our experience, we have created a really great partnership with a community account representative that works for Xfinity, Roberto Sanchez, and he has collaborated with us at a lot of events at different housing properties that he oversees. And the way we set it up is we will help the community members enroll in ACP, and once they are approved, we provide them with that information, and then Roberto's sitting right next to us and he goes in his system. They already have Xfinity as their service provider, or if they don't, he helps them sign up if that's the service that they would like to have. And he applies their credit right then and there. So it definitely saves you a lot of time and also is an opportunity to build that personal rapport and credibility. We can go to the next slide. Okay, there we go. The public library is also a great place to partner with. It already serves as a hub that community members have access to, and it creates an opportunity to combine ACP efforts with other resources that may be available at the library, such as devices or digital literacy skills classes. So this can be a great partnership as well. And then the local health department in our community has also been really helpful at creating a model back when COVID started of this boots on the ground campaign. And we've used this campaign to expand our ACP efforts as well. And we found that just like talking to people about COVID vaccines, doing it in person, face to face, even going door to door is often more useful and important and effective rather than creating social media posts or billboards, because a lot of the times if people are wanting to get access to ACP, they might not be on social media or they might not have access to all this other media that we can communicate through. So that is a great partnership to have as well. Next slide, please. Thank you. And then the way that we set up our outreach and enrollment events actually happens in 2 phases. And this is something that we found that works really well. So if possible, outreach and enrollment events should be completed on 2 separate occasions, and I'll explain why. The outreach event is kind of that first introduction that you have to meet people, to give them information about ACP, to answer any questions that they have, and make sure that they are prepared to actually apply for it. Give them the examples of the letters that they should have. We often print out sample letters of Medicaid approval letters or SNAP approval letters and bring them with us to outreach events to show applicants, hey, this is what you need. Make sure you have this next time we come so that we can successfully enroll you. Basically, just starting that pre-enrollment process sets them up really well for when you come to enroll them in ACP next time. So the enrollment can happen a few days after the outreach, if that's possible. And this allows community members to really get prepared, look for their documents. If they have any questions about their bill, give some time to look for that bill as well. And basically just sets them up to be ready to go for the enrollment session with them. So usually we allot about 1 hour per person for this enrollment event or enrollment sessions, and the hour can entail the ACP process, so you can get through the entire ACP process, and then if you have some time left over, you can also begin that contact with the ISP afterwards. If you have the client sitting right there next to you, it shouldn't be a problem. And it also gives you just the opportunity to provide one-to-one assistance for them beyond ACP. So assessing their digital literacy skills, assessing their connectivity needs, really talking to them about the different plans that are offered and if that fits into their budget. So 2 steps, outreach, then enrollment is what we found that works best. And for outreach and enrollment events, we have found that certain resources work better than others. And I'll start talking a little bit about the technology that we use. So we have found that tablets are the device that works best, and that is because they are obviously mobile and portable, and they also have a camera. So this makes it very easy to take pictures of documentation and upload them to the national verifier on one device. If you're able to get Apple products, that would also be great because of the AirDrop feature. So again, you can just send documentation from one device to another without having to email it to yourself or have the applicant email it to you, and it saves you a lot of time. If you don't have access to Apple products or to just phones in general, getting a portable copier and scanner can also save you some time and extra steps. It makes it, again, easy for you to send all the documentation, whether it be to your email or to a computer, instead of having to go to the library or having to go to another site to get that uploaded. And then as far as printed materials, we have found that a combination of using existing resources and also creating your own to fit your community's needs is really useful. We use a lot of resources from Education Superhighway, the NDIA, and what's on the FCC right now as well on the ACP website. But we also tailor them to what our community needs. For example, this here at the bottom is an example of a resource that we took from Education Superhighway, and we filled it in with the providers and plans that are existing in our community, so Xfinity and AT&T. And we use this resource when we meet with applicants to help them determine what the best plan for them is. And then on the right hand over here, we have a resource that we created for our community to use after we help them enroll in ACP. This is kind of like an exit ticket that we found that our clients need in order to keep all their information with them, all their ACP application information with them, and just for them to have it for future reference. And finally, I want to stress that collecting data is also very important, especially for funding and grant purposes. And the two that we have found that after, applying for all of these grants that just came up or that just opened up the applications, that demographic information like race, ethnicity, age, and also dates is really important to track. This helps you report on the impact that you are making with specific populations and also sets up that time frame to demonstrate your impact. And then some of the other things that we are starting to track as well are types and number of devices per household, number of new home internet users that are connecting to the internet for the first time with the help of ACP. And then we are also looking to help community members assess their digital literacy skills. So finding ways to weave in a digital skills assessment into our enrollment session and explaining to applicants why it's important to have those digital literacy skills after ACP. And with that, thank you very much. I hope that this was helpful. And if you ever have any questions or need to reach me, please feel free to do so. My contact information is here, and I would be happy to have a conversation with any of you.
Thank you, Elizabeth. I really appreciate your last point about how you're collecting data, because that brings me to a concluding point, because I'm at time. And so I appreciate all the panelists' shares. But what Elizabeth said about collecting data and what Andra is doing and what John has shown he can do with the data too, collecting data is going to be very important for us to advocate for sustainable ACP. As you may have seen in Doug Dawson's blog or heard elsewhere or are hearing now, the ACP is probably going to run out of funding by mid-2024. Which means that we have to convince this Congress to refund the program. And to do that, we're going to need your help, the help of advocates, the help of people who are doing the work in the community to get people enrolled. We need to understand why the ACP is essential, who it's helping, and what will happen if it goes away. I would like to hear this, I think everyone would like to hear this, from both the household's perspective and from the ISP. How does confidence in the ACP's existence help ISPs plan to build networks in unserved communities? If the ACP is not in the cards, are they going to be as likely to build to those low-income areas? I don't think they would be. So those are the two things I hope we can all keep in mind as we go forward. And I will just close, Kip, with the very last slide, which has some resources that I think will be useful. Yes, this one. So for everyone who may be winning an FCC grant or starting to do outreach and enrollment, I've compiled a few resources that might be helpful. The first is a state eligibility estimates. This is from Hernan Galperin at USC. He uses this and he talks through in his paper how to estimate eligibility in the state. And you want to know enrollment, but you also want to know eligibility. So this resource is good. The second, from Education Superhighway, is a dashboard of very similar data, and it gets very local. So you can use this dashboard to understand current enrollment and eligibility in your local community. Very helpful. The third is NDIA. They have practitioners meeting once a month, the ACP working group. It is a great place to come and talk about your issues and learn from others and get updates. Similarly, they are also collecting stories about ACP success. So I would encourage you to reach out to NDIA and use their form, which I can share in a follow-up if anyone's interested, to share your stories with NDIA. Finally, Institute for Local Self-Reliance has an ACP longevity tracker. This will help you understand the potential lifespan of the ACP and also its current performance. It's very slick, very useful. And on the right, key points, ACP is essential. As long as poverty exists, we will need a cost support program like the ACP. Navigators are key to getting the ACP to the people who need it most. As you've heard from Andra, Elizabeth, and John, particular libraries stand out in each of their presentations. And then finally, the ACP is running out of money. Mid-2024, this Congress, we have to convince them. Finally, a few deadlines if you're interested for FCC comments. And then I would invite you to reach out to Kip or myself for any follow-ups. And with that, I will close. I'll stay on. I don't want to make my panel stay on or any in the audience, but I'd be happy to address some of the questions if the panel is too. So we had one from, and I'll keep this limited. Andra, how often do you experience national verifier issues like the ones you mentioned?
I would say about half the time. It can be anything from, someone's identity needing verification for reasons that are not clear, to, needing documentation for their enrollment qualification and needing to provide like multiple different documents. It can get really tricky, especially when somebody's trying to qualify through their receipt of free and reduced lunch. Because not all districts have the same wording on their forms, and it's getting reviewed by human beings. And so for us, really, our experience, it's the inconsistency of the reviewers. I will say that when we call and advocate, we get help, we get feedback that says, nope, you got to find something else, or, for sure. But it's a fairly common occurrence. Yeah.
We've heard the same, but as you said, you can call the FCC. And raise these issues. I'll answer. Well, okay, Elizabeth, for you, how do you handle when a household has past due balance?
Yeah, I saw that. So Candace is my colleague, Candace Browdy, that she had responded to that question saying that the ISP, there's a policy in place by the FCC that the ISP has to provide at least the low cost internet plans and use or accept the ACP with that to provide the internet service to households. And I know that this is, it can be a hassle or it can be a long fight to have with ISPs sometimes, but I think we've gone through times where we've had to escalate these issues to management or personnel working in government affairs from different ISPs. And we've found a lot of them on NDIA, a lot of connections through the NDIA listserv and things like that. So I think just pushing for it is important, because these policies are in place for a reason. People are able to get internet service and apply their ACP credit, even if they have a past due balance. So just advocating for it, I think, is what's important.
Yes. And my understanding is that it should not bar you from using the ACP. Sometimes that takes a little clarification, though. That is why issues like that come up all the time. That's why navigators are so important. Because consumers may not know this, and it can take a lot of time. And if you're a low-income household, you have kids, you got to take them to school, you're busy with a job or two, you may not have complete access to a device. Having to go through this process can be a huge barrier. So I would just encourage everyone to look to the Digital Equity Act and these FCC grants to staff up and get the people power that is needed to really get this benefit out into the community. And with that, I will wrap up and thank you for giving me a little bit of extra time. But I would like to mention to please check, well, one, this panel will be available on Benton's YouTube page for future reference. So it will be recorded, you can share it. And then also we can share the slides and any information. And please reach out to me, and I won't speak for the other panelists, but please reach out, and I can connect you if you have any questions or want to speak specifically. Because this is a lot of organizations via the FCC grants may be doing this for the first time. We have experience doing this work, and we want to share it. We want to make sure that this funding is used effectively. So please reach out. I learned everything I know from other people. So I got to pass that on to keep good karma. And with that, I will thank the panelists. Thank you, John. Thank you, Andra. Thank you, Elizabeth. And thank you, Adrienne and Benton, for hosting this panel. And thank you, Kip, for running behind the scenes.
Well, thank you, Drew, and really, again, appreciate everyone's attendance and the good questions we got into the chat, many of which I think were answered. But again, if anybody has any further questions or comments, we'd be happy to help. Drew, terrific job moderating. And again, John, Andra, and Elizabeth, really am grateful for your attendance today. Thanks, everybody. Take care. Bye-bye.